While Cialis or tadalafil is widely known for treating erectile dysfunction, it also offers several lesser-known benefits. Here are the top 5 hidden benefits of Cialis. 1. It improves symptoms of benign prostatic hyperplasia, or BPH. Cialis is effective in treating BPH, a condition characterized by an enlarged prostate. It helps reduce symptoms such as frequent urination, difficulty starting urination, and the need to urinate urgently or during the night. By relaxing the muscles in the bladder and prostate, Cialis can improve urinary flow and reduce discomfort. 2. It enhances exercise performance. Cialis can increase blood flow, which may enhance exercise performance. Improved blood circulation can lead to better oxygen delivery to muscles, potentially boosting endurance and reducing fatigue during physical activities. This benefit can be particularly useful for athletes or individuals looking to improve their fitness levels. 3. It reduces pulmonary hypertension. Pulmonary hypertension is a condition where the blood pressure in the lungs' arteries is higher than normal. Cialis can help lower this pressure by relaxing the blood vessels in the lungs, making it easier for the heart to pump blood through them. This can improve symptoms such as shortness of breath and increase exercise capacity. Supports cardiovascular health. Studies suggest that Cialis may have cardiovascular benefits. By improving blood flow and reducing arterial stiffness, it can potentially lower the risk of cardiovascular events such as heart attacks and strokes. This makes it a valuable option for individuals with certain heart conditions under medical supervision. Boosts self-esteem and psychological well-being. Beyond its physical benefits, Cialis can positively impact mental health. Successfully treating ED can significantly boost self-esteem and reduce anxiety related to sexual performance. This improvement in psychological well-being can enhance overall quality of life and relationship satisfaction. These hidden benefits highlight the versatility of Cialis beyond its primary use for erectile dysfunction. However, it's important to consult with a healthcare provider before using Cialis for any of these purposes to ensure it's safe and appropriate for your specific health needs. If you have any more questions or need further details, feel free to ask. The appropriate dosage of Cialis or tadalafil depends on the condition being treated and individual factors, such as response to the medication and any underlying health conditions. Here are the general guidelines. For erectile dysfunction, or ED, as needed, the starting dose is 10 mg taken prior to anticipated sexual activity. Depending on effectiveness and tolerance, the dose may be increased to 20 mg or decreased to 5 mg. It should not be taken more than once per day. For daily use, the starting dose is 2.5 mg taken at the same time every day, regardless of the timing of sexual activity. The dose may be increased to 5 mg based on individual efficacy and tolerability. For benign prostatic hyperplasia, or BPH, daily use, a dose of 5 mg taken at the same time every day. For both ED and BPH, daily use, again 5 mg taken at the same time every day. Special considerations: kidney impairment, dosage adjustments may be necessary. For example, for those with severe kidney impairment, the maximum dose for as-needed use is 5 mg, not more than once every 72 hours. Liver impairment dosage should not exceed 10 mg once per day for mild to moderate liver impairment. Cialis is not recommended for severe liver impairment. It's crucial to follow your healthcare provider's instructions and not to exceed the recommended dosage to avoid potential side effects. Always consult with your doctor to determine the best dosage for your specific situation. Yes, while Cialis or tadalafil is generally well tolerated, it can cause serious side effects in some individuals. Here are some of the serious side effects that have been reported. Sudden hearing loss or ringing in the ears. Some users have experienced sudden hearing loss or tinnitus, which is ringing in the ears. This can occur suddenly and may be accompanied by dizziness. Vision changes or loss. Cialis can cause vision changes, including blurred vision or a sudden loss of vision in one or both eyes. This condition, known as non-arteritic anterior ischemic optic neuropathy, or NAON, is rare but serious. Chest pain and heart attack. Cialis can cause chest pain, an increased heart rate, or even a heart attack, especially in individuals with pre-existing heart conditions. Prolonged erection. also known as priapism. A prolonged erection lasting more than 4 hours can occur. This condition requires immediate medical attention to prevent permanent damage. Severe allergic reactions. Severe allergic reactions, including hives, difficulty breathing, and swelling of the face, lips, tongue, or throat, can occur. These reactions require immediate medical attention. High or low blood pressure. Cialis can cause significant changes in blood pressure, leading to either high or low blood pressure. This can be particularly dangerous for individuals with cardiovascular issues. What to do if you experience serious side effects? If you experience any of these serious side effects, it is crucial to seek medical attention immediately. Do not ignore symptoms like chest pain, sudden vision or hearing loss, or a prolonged erection, as they can have long-term consequences if not treated promptly. Conclusion. While Cialis can be very effective for treating erectile dysfunction and other conditions, it's important to be aware of the potential serious side effects. Always consult with your healthcare provider before starting Cialis to ensure it is safe for you, especially if you have underlying health conditions.